What if the reason nothing has worked for your pain is because no one tried helping your body heal at the cellular level? Hi, I'm Dr. Jason Hahn, rehab expert and CEO of HealthFit in Pasadena. If you've been stuck in pain, despite trying therapy, injections, or even surgery, you are not alone. In this video, we are going to explore a completely different approach to healing: regenerative therapy using Shockwave and EMTT. It is a powerful, non-invasive option that supports your body's natural recovery without downtime, drugs, or surgery. For years, we've been told that healing happens through intense rehab, medications, or injections. And when those don't work, surgery seems like the next step. But what happens when none of that makes a lasting difference? As a clinician who's worked with everyone from elite athletes to active adults, I've seen this story play out again and again. You've done the physical therapy. You've tried cortisone shots, maybe even multiple opinions. But you're still in pain and you're still waiting for a breakthrough. But what I've learned is this: healing doesn't always mean doing more, it means doing things differently. That is where regenerative therapies like Shockwave and EMTT come in. These technologies don't just manage symptoms, they stimulate deep cellular healing, often in people who thought they had exhausted every option. Here's how it works: Shockwave therapy. We use two different types: radial and focused. These sound waves penetrate the tissue, increase blood flow, and break up adhesions, and they kickstart your body's natural repair process. Focused shockwave targets deeper structures like tendons and joints, while radial covers broader surface tissue. Together, they create a layered, powerful effect. EMTT, also known as extracorporeal magnetotransduction therapy. This technology uses high-frequency magnetic pulses that reach the cellular level. They stimulate tissue regeneration, they reduce inflammation, and they accelerate recovery. It's like charging up the cells that have been stuck in injury mode for years. Together, these therapies activate circulation, repair damaged tissues, reduce chronic inflammation, and most importantly, help people heal when nothing else has worked. The results are real. Studies show that patients receiving both shockwave and EMTT report significantly reduced pain and improved function, especially for conditions like Achilles tendinopathy, plantar fasciitis, rotator cuff issues, chronic low back pain, early arthritis, and degenerative changes. Many start to see meaningful improvement in just 3 to 5 sessions. And look, I get it. If you're skeptical, you have every right to be. Most of our patients come in frustrated, discouraged, and doubtful. They've been through the system, they've tried standard treatments, and they've learned to lower their expectations. But that is exactly why we're so passionate about sharing this. Because for a good number of people, this does work. Not just in theory, but in practice. Let me share a story that still gives me a smile. Mark, he came to us in his late 50s. Basketball was his thing. He loved the game. He played several times a week for decades. But then came the Achilles pain, followed by plantar fasciitis. He tried it all: therapy, rest, orthotics, but nothing gave him lasting relief. So he adapted. He stayed active, but with swimming, biking, and the elliptical. But he told us it just doesn't feel the same. I miss moving the way I used to. I miss feeling like me. When Mark came to us, he had been living with foot and tendon pain for 25 years. We started him on a course of Shockwave and EMTT, targeting both the Achilles and the plantar fascia. Within weeks, his pain during walking began to fade. His stride felt smoother, and by the end of treatment, he picked up a basketball again for the first time in decades. And he wasn't just moving better, he felt like himself again. That's what real healing looks like. This type of regenerative therapy is for people who've tried traditional physical therapy or injections with limited success. Those dealing with chronic tendon or joint pain, active adults and athletes trying to avoid surgery, and anyone who wants a smarter, non-invasive way to actually heal, not just cope. We know how discouraging this journey can be. We see it every day. Patients walk through our doors with pain in their body and doubt in their mind. And that's okay. That's human. But what drives us, What gets us out of bed every morning is knowing there is another way. For many of our patients, this is the moment they finally start to get their life back. We are here for you, and we'll meet you where you are. So here's the question I want to leave you with. What if the problem isn't your body's ability to heal, but that no one's activated it in the right way? You do not have to live in limbo. You do not have to settle. Let's find out what's possible together. To take action, I have 3 options for you. 1. Inquire about an initial visit. Let us evaluate your case and walk you through your options. 2. Visit our website and find out more about Shockwave and EMTT and how they work and who they help. Last but not least, number 3, call us directly at 626-365-1380. We are here to listen and to help you take your next step. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.